What's going on, guys? I'm Bryant Acquaro. I'm the Director of Rehabilitation here at NJ Spine and Wellness in Freehold. I'm a physical therapist. We're running a little bit of a Zoom meeting here with Doc. Introduce yourself, man.
How's it going, guys? Dr. Ammar Saymeh. I'm a foot and ankle surgeon and specialist here at NJ Spine and Wellness. Went to school at Temple, did residency at Cooper. Now I'm here.
So yeah, we're here. We're on a bunch of different platforms right now: Zoom, Instagram. We're on YouTube as well as Facebook Live. So if anybody has any questions throughout this, please shout them out in the comments. We're going to answer some of the ones that have come in so far, and just going to go over any foot and ankle questions or injuries or concerns or thoughts you guys might have. So feel free to reach out. Yep. We also have Elise and Bill here from our marketing squad.
Woo!
Yeah,
what's up?
Moderating, so you might hear them coming in and out.
Doing a solid job.
Yeah, they're killing it, working multiple platforms right now.
We're trying our best here. That's what we do. All right, so guys, just quick introduction. You know how everyone's doing right now with everything that's going on with the pandemic. Let me hear about the current state of the clinic at NJ Spine and Wellness and how people are coming in. Are they doing stuff online? Like, what's going on? Yeah,
absolutely. So we're offering telehealth sessions just for medical side as well as physical therapy and rehabilitative side. We are also doing a lot of patient visits in-house here. We are wearing masks, we're wearing gloves, we're social distancing, keeping everybody 6 feet apart, and just trying to treat people from that point too. And we also have private rooms available. So if you need to come in for a consult, you want to come into a private room, you can obviously do that as well. I don't know if you have anything you want to add to that.
Yeah, no, I mean, pretty much the same thing they're doing on the conservative side, on the medical side, same thing. You know, everyone's wearing a mask. The docs are wearing the masks. The patients are coming in with masks, and if you don't have one, we have supply for you. But, you know, we can see it in person or via telemedicine.
Sweet. So Todd's talking right now. He's asking questions. He's telling me his big toe hurts, his foot hurts, his ankle hurts. He's got a lot going on right now. So if you guys could just give us some information about how you treat foot and ankle in office and maybe some information on what we could do to help Todd.
Yeah, so, hey, Todd. So really, you know, when it comes down to treating anything foot and ankle, you know, first and most important thing is really for me to be able to get my hands on the patient. First and foremost, do, you know, a clinical examination, see where the pain is, whether it is, you know, truly foot and ankle or either or. And then going from there, you know, whether you need X-rays, MRI, CT, we really build on that. And, you know, if you need physical therapy, then that's where, you know, Brian and the rest of the team comes in.
Yeah, absolutely. I think, you know, a good exam is critical. You know, having somebody really take a look at everything and make sure we're teasing out what's injured, where the pain is. There's a lot of things that kind of can look similar or present similar, but upon actual true examination, you may find a lot of differences between each, and that kind of gives you a different diagnosis. And then, like Doc said, building on imaging, building on strengthening, and everything else from there. Any common injuries that you kind of notice and see most often in practice here? Or?
Yeah, I mean, a lot of people, especially with everything that's going on, they're exercising more, they're running outside, you know, doing stuff that they really haven't done previously over the last few years. So they're trying to stay more active because they're not allowed to, you know, go to doing their routines that they usually do. So, you know, they're coming in with stress fractures, plantar fasciitis, Achilles tendonitis. You know, that's swelling and inflammation of the Achilles, in the back of the heel, on the bottom of the heel. That's really where a lot of people are coming in and saying, you know, that also they're spraining their ankles while running, stepping off a curb. Those are really the most typical things that I'm seeing right now.
Yeah, I'd agree. I think one big thing that people overlook is the surface that they work out on. So when you go to a gym, typically the floor is matted. There's typically about 3/4 of an inch of matting on the floor, which provides a cushion when you're doing exercise, when you're doing plyometrics, jumping, box jumps, jumping jacks, planks, any of that kind of stuff. And when you start doing these workouts at home, I see a lot of them on Instagram. They're elaborate and sometimes a little bit dangerous, like deadlifting your couch, for example. But what happens is people tend to come in from overuse injuries a little more frequently right now because they're not having that extra cushion. So that's something that we try to address here, and people kind of overlook when they are doing stuff. When you are at home, if you can put a yoga mat underneath you or something else like that, maybe stack 2 of them on top of each other if it's safe to do so.
Yeah.
You know, footwear, I think is something we can talk about.
Exactly. Yeah, I'm also seeing a lot of people who are just doing workouts at home barefoot. That's a big time no. You definitely need support while you're doing these high energy, aerobic exercises, whatever it may be. You should always be in sneakers, always be in support, or else you're going to end up with severe pain, random strains and sprains of the foot or ankle.
Yeah, absolutely. I think that a lot of times here in the clinic, we work on a lot of strength in the foot. So we work on intrinsic strength. We take the shoes off. We do a lot of kind of stuff. But if you're used to doing, burpees, 100 burpees a day, like my man Matt does, and you suddenly start doing those barefoot, that amount of strain on your foot when it's used to having a cushion versus not is going to be pretty aggressive. And it's definitely going to cause some pain and some stiffness and other problems. So, I know there's a barefoot minimalist shoe culture out there, and I love the idea of it, but you also have to work your way into that slowly. You can't just go doing your normal workout just without shoes on. It will end up hurting you or leading to stress fractures.
Yeah, for sure.
You
Let's get into some questions. We have a couple questions that are coming in. So the first question is, could my shoes be causing my bunion?
So bunions are they're both hereditary and they can become acquired. And what I mean by that is you can get them from mom, dad, grandma, grandpa, but they can become exacerbated by wearing certain shoe gear. High heels for sure throws off the intrinsic muscles of the foot, and it often causes that first metatarsal where the big toe joint is to kind of splay outwards, and then have the big toe itself move to the other side. So the answer to that is yes. It can cause bunions. It could make bunions worse, and can also make it more painful for sure.
All right, we got Steve here asking a question. He goes, I don't have foot or ankle pain. I have knee, hip, and back pain. Can you guys help me?
Yeah, of course. We can help you. Absolutely. This comes right up my alley. Obviously, it depends on what's going on with it, but we can definitely help with that kind of stuff. A big thing I talk to people about is two things. There's kind of two philosophies in physical therapy. There's either a top-down, meaning that the core is where everything needs to be stable, and that stabilizes the limbs, which I agree to a certain extent, but also from a bottom-up perspective, meaning that the foot and ankle can actually lead to a lot of your knee, hip, and back pain as well. So if your feet are very flat, if your footwear is improper, it puts your feet at a bad angle, and that could kind of create a problem up the kinetic chain, or we call it up the whole leg. I've had patients who had improper orthotics and presented with low back pain, and we changed out their orthotics, and that actually resolved pretty much all of their pain. And then we just worked on a little bit of core stability and core strengthening, and that helped them out. So 100%, these problems can definitely come from those areas, and it's important to address the entire system. You can't just address the knee. You have to look at the foot and ankle and look at the core and look at everything else there as well.
I think that's the beauty of what we have here at NJ Spine and Wellness is that we have people treating everything from foot and ankle to the neck. So everything is essentially related and linked, and it's a whole body approach. So that's why if you're having hip pain or knee pain or lower back pain, they can send them over to me. Make sure that your gait is normal, that your stance is normal, and if you need adjustments here or there, we can go ahead and do that.
Absolutely, definitely. And that's it. That's the idea. You want to take a whole approach to the body. You don't want to just look at one joint, but actually have a collaborative effort amongst your team. That's key.
All right. Another question that came in is, what do you recommend for a patient that has frequent bone spurs?
So bone spurs are also almost like a common misconception. There's bone spurs in the heel, as well as bone spurs with various joints as a result of arthritis. So bone spurs in the heel are typically a common cause of either plantar fasciitis if they're on the bottom, or Achilles tendonitis which are on the top. You don't typically get pain as a result of bone spurs. Bone spurs they usually don't come and go. They're kind of just there. So we actually address everything around the bone spur typically. Unless we're talking about surgical intervention on a joint where we typically shave down the spur itself. But in terms of plantar fasciitis and things like that, I typically address the plantar fasciitis, and that will really take care of, any issues with what people think is the spur causing the pain.
Yeah, I agree. I think that we get patients who think a bone spur is like a death sentence. They're like, oh my God, I have a bone spur. It's never going to get better. That's that. And that's a common misconception. Your bone spur can be asymptomatic. And even if your bone spur is causing plantar fasciitis, you can typically treat the plantar fasciitis and get rid of it without having to go in there and shave down the bone spur. I think that's pretty much like a worst case scenario that's happening through that sort of
I think less. I would say less than 5% of patients need any type of surgical intervention for plantar fasciitis. That's what the medical literature shows us, and it's actually probably even less than that at this point. Very rarely do we have to go in and do that. It's usually treated conservatively via orthotics, different injections, whether it be corticosteroid injections or PRP, which we do here as well. And then, of course, physical therapy plays a huge part in it. That's a huge way of getting patients back on their feet, getting them back to what they like to do faster.
Yeah, and typically with the plantar fasciitis, which I know is a common hot topic, I'll kind of jump on that since Doc mentioned it. When we see plantar fasciitis, it's inflammation of the plantar fascia, which is basically sitting underneath the bottom of the foot. So on the sole of your foot, you tend to get inflammation. Hurts when you first get out of bed. As you walk around, you get blood flow in that area. It typically feels a little bit better throughout the day, and then later on, or if you're sitting for a while, you tend to have that pain again.
Right.
One thing that we notice is that because we are in shoes so much, a lot of times our foot muscles, the muscles that sit inside the foot, we call them intrinsic muscles, they tend to atrophy a little bit. And this leads to one or two things, right? It leads to the arch maybe collapsing, or you getting a little bit of like pes planus, aka flat feet. Your feet kind of fall inward. That can kind of leave you predisposed to it as well. And so strengthening and building those muscles up, getting them to fire again, getting them to work the way they're supposed to again is very helpful. And then obviously as well, supporting them accordingly, because if they've been flattened out for 20 years, you're not going to build that arch up just through exercise. You're probably going to need an orthotic or something else to help out as well as the exercise.
Right. Yeah.
Yeah.
And other things that you'll typically, people will feel when they have plantar fasciitis is specifically that first step out of bed that progressively gets better.
Yeah.
So that first step out of bed may feel a sharp pain in your heel, or those are things to kind of look out for with plantar fasciitis, especially as they get better throughout the day and they start to feel better. They'll sit down again at their desk where they're working, and then again that first step when they get up is significant and painful. Plantar fasciitis can be, chronic in the sense that it can go on for months. I've even had patients who dealt with it for years. Or it could be a simple injury where, you go to physical therapy, you get orthotics, you get all types of conservative treatment, and you can get back, to your life and to running and exercising quicker.
Yeah, absolutely, definitely. And I think that's the key is, being consistent with it. I think if you have plantar fasciitis, and a lot of people suffer from it, something as simple as just pumping your ankle back and forth when you first get out of bed before you put your foot on the ground will get some blood flow. It'll soften that pain you feel as you step down. Consistency with stretching, making sure you have the right footwear, orthotics, those are going to be your keys to really getting over the top, and then working on, keeping those feet strong, the same way we try to keep everything else in our body strong.
Someone asked an interesting question. Do you see patients with incomplete SEI, C1, C2 balance issues? And if so, how would you treat that in office?
Wow. Yeah.
It's a very in-depth question, but these are the type of people that are listening in. They're very educated. Love it.
That one I would love to hand over to my guy, Dr. Michael Zolo, up in our Old Bridge clinic. I got to shout him out. He's our neuro specialist around here. We do treat these types of cases. We do work on some balance and things like that. Obviously, with something that's specific and serious, we have to, take a good look at the case and present it and get a good exam to see what kind of progress we can make. But depending on the level of ability, depending on the level of, kind of neuro skill level and everything else, we could probably get them doing a variety of different things. It would just kind of depend on an exam in that case for sure.
All right. Next question is, as a teacher, I am constantly standing on my feet, causing pain and even some pain in my back. Do you have any suggestions for me?
Yeah. So, I think if you're having foot pain, teachers typically are standing on what has the base of a cement floor. So it's really got no give whatsoever. So I've got a lot of teachers as patients, and typically, we'd obviously need to see them first in office to do a foot exam, maybe get some baseline x-rays, make sure no underlying arthritis is there, and no other abnormalities with the bone or, any type of tendinous or ligamentous issues are going on. But for a lot of my teachers, they do need that added support, added cushion, as well as added arch support. So custom molded orthotics that we do in the office here with our 3D scanning technology is really helpful. A lot of patients, really love it. The quality of the orthotics that we have is, I think, second to none. So it's really helpful, and I can't say it enough how important it is for a teacher to get into good supportive shoe gear.
Yeah, absolutely. I mean, as somebody who stands for 10 to 12 hours a day at work, typically, I couldn't agree more. Our floors are very similar, unless you're in our turf room or in our gym area. I tell people all the time, if your feet are in contact with the ground and they're weight bearing for you for hours and hours on end, you have to take good care of your feet. So good foot health is key. Building strength in them, making sure you have good shoes. A lot of us let our shoes go for way longer than you should. And a lot of us kind of just let likewise, orthotics that I see people had for 6-7 years, making sure you're updating that kind of stuff. And also making sure you're working on the strength in there. It's going to help you with your feet. It's going to help you with your back pain as well, because a lot of that translates right up the whole chain that way. So those are just typical easy modifications that we can usually make. If you look at the bottom of your shoe and you see a lot of wear on there, meaning that the treads don't look nearly as good as they did, that shoe's already way past its mileage. Typically the inside of the shoe is going to wear down before the outside does. So it's important. And buy good, comfortable shoes that you just wear to work. I know for teachers that can be hard, but they make some pretty good stuff with pretty good insoles and stuff down.
And even if we're talking about teachers, but even if you're not a teacher and you're on your feet in dress shoes, there are specific orthotics and support that we make for dress shoes. So a lot of people think, oh, it's not going to fit in my flats or something with a wedge, specifically for women, but that's not the case. So it's just a matter of everything can be tailored to your lifestyle.
Yeah.
I have an athlete here. His name's Michael, and he is dealing with a fractured foot, and he wants to know what will happen if I don't care for this properly, if I just keep playing ball.
Yeah. So you definitely depends on obviously any type of fracture. You want to stay off of it for sure. If he's been seen by a doctor, then you should have certain X-rays. If you don't care for the fracture in your foot, there's a tendency of it healing incorrectly, and if it does heal incorrectly, the likelihood of what we call post-traumatic arthritis, meaning arthritis that happens subsequently to any type of trauma, any type of fracture in the foot, can lead to significant pain later down the road. Once you start to have post-traumatic arthritis in specific joints, it can lead to imbalancing of biomechanics of the foot, which can also lead to limping, which could throw off your entire gait, which 100%. Is where Brian would come in here.
Yeah, for sure. I mean, I make the comparison to my patients, right? Your body's like your car, and when the check engine light comes on, meaning something is wrong, if you don't bring your car in for service relatively quick, typically you end up with a lot of problems with your car instead of one problem. And the same thing with your body is if you go and you have a fracture in your foot or something like that, you go out there, you keep playing ball on it. It may seem like it's a small bone, it's no big deal, but it may lead to you offloading, putting more weight on the opposite foot. That causes hip problems. That causes your back to be in trouble. That can cause scoliosis. That can cause a host of other problems that, you may see immediately. You may not see for years down the line, but typically that type of compensation is going to lead to damage elsewhere, which is why it's more important to take care of the problem at your foot right then and there.
Yeah, and if it's initially a non-surgical case, when you fractured it, it can very easily turn into a surgical case where I'd have to go in and really reset the bone and align it and put some hardware in it, and then you'll eventually be out another 6 weeks from the initial time of injury. So you definitely don't want to make it worse.
Yeah, absolutely.
All right, so we have Nicole who just tuned in, and she wants to know, what can you do for flat feet? Are there any exercises that will help?
Yes, absolutely. So this is something we see commonly. A lot of times it's an incidental finding, meaning that somebody comes in with knee pain or hip pain or back pain, and as we look down the chain, we notice that their feet cave inwards there. Instead of having a nice arch like this, their foot kind of falls inward this way, and that creates the knees to fall inward as well, which creates kind of pressure on the outside of the hips, and that can lead to back pain or hip pain or even knee pain in a lot of cases as well. So there's a couple different exercises we do. One is called toe yoga. You can look that up on YouTube, which we're live on, and you'll find plenty of videos on that. There's also something called a short foot exercise, Yanda short foot, Janda, which is kind of one that helps dome the arch or arch doming. That's a great one as well. Those are very basic ones that we start with in the clinic that you can start doing daily as a good way to work on. Essentially what they do is strengthen the muscles in the arch that kind of rebuild that upward a little bit and help out. Like I was talking about before, I think that it's important to recognize too that if you've had flat feet for a very, very long time, this exercise might help, but you may need an orthotic, especially in certain shoes if you're on your feet a ton. If you're going to run on them, if you're going to do different things that way, it might not be a bad idea to get in them. But I do encourage people like that to get barefoot in their house and to work on getting a little more strengthening in those muscles as well.
Yeah, I mean, with flat feet, there's a lot of issues that can result from them, specifically arthritis, tendonitis, tendonitis along, especially the tendon that runs on the inner portion of the ankle there, can also result in micro tears and even more significant tearing of that tendon because of the extreme stress that's put on it as a result of the collapsing foot. So, you know, it may not be something significant in terms of pain right now, but I often see people, you know, who, you know, maybe in their 40s and 50s who have just started to notice that they're starting to have pain within their foot. And it's likely a result of just not keeping up with, you know, taking care of their foot and really keeping up with just giving their foot enough support over the years that their tendon doesn't become an issue, or, you know, their joints aren't becoming arthritic as a result. Because with flat feet, all the joints are typically thrown off in one way or the other, even if it's very, very subtle. So it's important to kind of keep an eye on that.
Yeah, agreed, 100%. Posterior tibial tendonitis, which is the tendon on the inside of the leg there that Doc was talking about, is very common. And like you said, you see it a lot in people in their 40s, 50s, 60s who have probably dealt with flat feet their whole life, and then now they're finally having this overstretching of that tendon or degeneration of that tendon in a lot of cases. And it's very hard to fix down the line. So you're better off fixing it before the pain starts, because that inflammatory cycle can be difficult.
All right, so we have another question. My daughter has these white bumps, like little hernias, on the inside of her foot, close to the heel, that really hurt her. Just wondering, do you know what they are?
Yeah, so without seeing a picture, obviously it's difficult, but from your description, they sound like something called piezogenic papules. And essentially what that is, they're fat deposits that have made their way to the dermis, to the outer layer of the skin. And they typically will show up when weight bearing. And they can become painful in a very small amount of the patients who actually have them. You know, if the only way to really treat it is to come in, you know, some compression may do it, some heel taping may help with the pain. But to get rid of piezogenic papules completely is a little bit difficult, I'd say. But to definitely reduce the amount of pain and discomfort is something that's possible.
All right, my girl Fatima, shout out. What's up, Fatima? She says, I'm experiencing numbing in my toes, sometimes after running, even just sitting at my workstation. What causes it, and what can I do to treat it?
So if you're just sitting there and you're experiencing numbing, it might be the shoe gear that's pressing up against any number of nerves that are in the foot or the ankle. So if you're maybe wearing too tight of shoe gear, that's likely to cause you know, some neuropathy in the big toe and some numbness in the big toe itself. I would say to treat it, wear a wider toe box. You know, wear a wider shoe and see if that works. I don't know, Brad, do you have anything else to add to that?
Yeah, I mean, I would agree. I think wider toe box is probably the immediate one. I think that, you know, obviously Morton's neuroma could be the case too. And depending on what toe it is, I wasn't sure if she said which one.
Big toe, yeah.
Big toe. Okay, yeah. So Morton's neuroma's out. But
Yeah.
I would say the only other thing too, obviously, you want to look at his low back, and you want to make sure that up the chain there's not a disc herniation or anything like that. You know, that's a quick neuro screen. If you notice it, a lot of times people think, oh, I have to have back pain to have a disc herniation, but a lot of times we do see, you know, if that lower lumbar area has a problem, it could actually affect into that big toe. You can notice weakness in the big toe as well. That's the kind of thing that you obviously want to get a look at and exam at, just to make sure we can tease out what's causing what and make sure that it's not coming from up in the back versus in the toe.
She said second and third. LOL.
Oh, there you go. Nice.
Oh, okay.
Clarification.
So that might be a neuroma. That might be the Warren's neuroma. So that sounds more like it. So if it's something that's like a shooting pain or numbing pain, then that's something that could be treated actually in the clinic. Sometimes with steroid injections, sometimes with usually with steroid injections for the most part. Sometimes with some padding to offload that area. Depending on how big the neuroma is, it typically may take multiple injections. It's all really dependent on the patient and how they respond to the initial injection.
Can you explain how a more what exactly is compressing the neuroma to create that?
So a Morton's neuroma or neuroma, any neuroma in general, is caused by inflammation of the surrounding is of the nerve itself. So it's inflammation of the nerve that causes irritation and causes that shooting pain. It can be a result of many things. It could be a result of tight shoe gear. It could be a result of an injury and a traumatic hit to that area that causes the nerve to kind of act up and flare up.
Yeah, definitely.
So
seen some good results with cortisone, obviously in the clinic. That's an easy, quick way to just knock it out because it does decrease that inflammation in there.
Yeah.
All right. So we have a question on Instagram from Wham Bam Thank You Sham.
Yes.
Great handle.
Love it. Great handle.
So he said, Doctor, my plantar fasciitis is intermittent, worse when I increase my activity like running, but sometimes it doesn't hurt at all, and it's been about 2 years. What are my options?
Oh, okay. So I actually know Wham Bam Thank You Sham. He's an orthopedic surgeon friend of mine.
Nice.
Works down at Temple. So what can I do? What can you do for that? So it's probably because you're not stretching appropriately. You're not doing all the stretches to the extent that you probably should be doing them. And you're not doing it to the level and extent that you're also running. So if you are intermittently running, 2 to 3 miles once every month or once every few weeks, that's not a normal exercise for you. So it's aggravating and increasing the inflammation within the plantar fascial band and in your heel. So that, and you got to make sure you're wearing the right support. So that, in addition to the stretching exercises, should really do it. Taping also helps. Strapping and taping of the plantar fascial band and heel really significantly helps and reduces the inflammation and gives it some good support.
Yeah, definitely. I agree. I think intermittent pain is the hardest to treat sometimes because when you don't have pain, it's out of sight, out of mind. So it's hard to continue. You think, oh, I feel great. I go for my run. I'm not going to bother doing those stretches they told me to do because I feel good today. And that's a problem with plantar fasciitis because, like I said earlier, you just need that consistency. I think a good point was taping or strapping. I love rock tape. That's one of my favorites. I like to use that on a plantar fascia. Also, I tell people all the time not to neglect the calf. So you want to make sure you're also doing some gastrocsoleus stretching. It does attach into the calcaneus. It could also create a little bit of inflammation in that heel area as well. So I always incorporate some calf flexibility work and some eccentric work in there as well with my plantar fascia patients, just to kind of open that whole chain up there. You want to get the whole posterior chain, especially if you're a runner. That's huge.
Yeah, because the calf is literally directly related to the plantar fascia. So if your calf is tight, your plantar fascia is going to be directly affected. So stretching stretching just even once a day. If you have plantar fasciitis, in my opinion, isn't enough. I think you need to stretch multiple times a day for 15 minutes in the morning, at least 15 minutes in the evening, to really see any kind of result and to get rid of the pain.
Yeah, definitely. I made this joke before we went on here, but it's true is that, if you stretch for 15 minutes in the morning and then you go about the other 20 plus hours of your day that you're awake, maybe a little less than that, maybe 18 hours a day, without doing anything for your foot, that 15 minutes of stretching isn't going to be enough. You really got to practice good foot care by stretching multiple times throughout the day. It doesn't have to be formal. You could be standing up at your desk and stretch a little bit. You could just kind of throw it in intermittently and it'll help you out.
Ocean Eyes 913, what's up? She wants to know when she walks on the treadmill for more than 15 minutes, balls of her feet get numb and tingling. What could that be from?
So it's probably a result of the continuous impact that she's putting while she's on the treadmill. There's something called metatarsalgia, and metatarsalgia is referring to the metatarsals that are at the bottom of her foot where the ball of her foot is. And that consistent impact on exercise causes inflammation and swelling. Can also cause symptoms such as numbness and some even throbbing pain as well. Ways to alleviate that is again extra padding, extra support there, and just making sure you're in the right shoe gear.
Definitely, yeah. And I always tell people too is that I'm not a huge fan of like tremendously changing the way people walk or run or do things, but when you're on the treadmill, you should be listening. A lot of times you throw headphones in, you don't really listen to the sound of what you're making on the treadmill. But if you sound like you're really hitting the treadmill very hard, or you notice the treadmill bounces a lot while you're running, that kind of stuff, you want to try to practice like running quieter, walking a little quieter while you're on the treadmill, because you may be kind of just slapping that foot down over and over, and that's going to cause pain and just kind of like an overuse syndrome in that area. So,
Dr. Bryant, we have a question for you. What kind of physical therapy goals do you look for after an operation?
Ooh, nice. All right. Well, obviously it depends on the operation to an extent, but I can give you a typical rundown of our protocols for therapy for any sort of operation that we see. Once doc clears them to return to physical therapy or to begin physical therapy, obviously our first goals are to decrease swelling. So we want to decrease any post-operative inflammation. We want to get in there and work on range of motion, trying to restore normal range of motion in the foot, in the ankle, and whatever joints may be affected is key, because if your foot does not have the right range of motion, or your big toe doesn't have the right range of motion, or your ankle doesn't have the right range of motion, you're going to have trouble with gait patterns. You're going to have trouble with walking. It's going to be difficult. So you want to make sure you can work on that stuff. Next, obviously we start to work on weight bearing. We work on gait to make sure that they aren't walking with a limp, that we aren't, we get them walking normal as possible. And then after we accomplish all that kind of stuff, we're going to work on a lot of strengthening. So we start with very isometric, meaning that you don't do a lot of movement. It's sort of matching pressure, and we work our ways into more aggressive stuff. And, our goals are to return people back to whatever they do. So if you're an athlete, we're trying to get you back to sport. You're going to do sport stuff. If you're somebody who sits at a computer all day and only gets up here and there, we're going to work on your goals. If you're a golfer, we're going to work on that. So it just depends on what the person's goals are. That's what we try to tailor our treatment.
Yeah.
All right, one other question. Ashley said, do hammertoes go away without treatment?
So the answer to that is no. So hammertoes will either stay the same or they'll progressively get worse. They're not going to ever go away. There are two types of hammertoes. There's flexible and rigid. Typically flexible are less painful. As time goes on, rigid hammertoes are a result of the joints within the toes becoming degenerative and really losing some cartilage and becoming arthritic. So hammertoes initially, the flexible hammertoes are a result of an imbalancing of tendons. So either the tendon on the top or on the bottom getting weaker for whatever reason. There's several different reasons, but essentially flexible hammertoes can turn into rigid hammertoes, which often need surgical intervention at that point. I know Bryant does some work with flexible hammertoes in terms of taping and strapping that can help sometimes alleviate some pain in the short term, but likely for long-term outcomes, it's going to need more surgical intervention.
Yeah, absolutely. Yeah, we'll do strapping or taping and try to work on taping them into like a little bit more extension, depending on what's going on. And like Doc said, I tell people all the time, like it may make it a little more asymptomatic for the moment. It may get them through a point, but they are going to have to consider, obviously, surgical intervention if it remains painful and as it worsens, because you don't want to keep going that route. So yeah, they're a tough one. Any other questions from our moderators?
We do have one more that came in. We kind of touched on it a little bit, but this person kind of just joined in on Facebook. So what are some of the most common causes of foot pain?
So there's a ton, but just like we kind of went over this previously, most common things we'll see, plantar fasciitis, heel pain, pain along the arch, even pain along the bottom of the foot where the ball of your foot is, bunions, hammertoes, ankle sprains and strains, Achilles tendonitis. Those are all, typical foot and ankle pathology that, I see coming into the office every day.
Yeah, absolutely. I mean, I think I could give you guys some take homes. They would be to work on strengthening the foot up. So, when you're in your house, taking your shoes off, being barefoot, working on balance. A lot of people come in and they say, oh, I've always had bad balance. Balance isn't like a genetically bad thing. It's something that develops worse and worse over time. So you really want to practice strength in your ankle. And one of the best ways to do that is through balance. And then also making sure that your proper, footwear, and if you need orthotics, proper orthotics as well, and making sure that you're keeping these up to date. You're not letting them go years and years before you replace them, because that's the most common way to end up with a tendonitis or an injury of any of the ones that we were just talking about.
Yeah, the one thing I'd say about walking barefoot though is if you have plantar fasciitis, it's one thing you don't want to do. You always want to have some kind of support in the house, or else it could definitely exacerbate it and make it worse.
Yeah, that's a good call. Yeah, I'm talking asymptomatic before you have the injury, but yeah, once you do have the injury, you're gonna have to start to work on it from the other end. So 100%. Thank you for clarification.
Alright.
Awesome. Are we all set? We're good? Yeah.
Is that it?
Good stuff. So you
Alright,
covered
yeah.
everyone's questions.
Perfect. Yeah. So if anybody does have any other questions, if you guys want to shoot us a DM through either NJ Spine and Wellness or Bryant_NJSW, Dr. Ammar_NJSW.
Follow me.
Follow us. That's our shameless plug. Or feel free to come to the clinic. We are open. We are, like I said, obeying all the CDC guidelines. So we're more than happy to help. And if you guys want to give a call in or something like that, you're more than welcome to.